evidence-based approach to personal hygiene. Dorothy L. Lister, SC, and Royal Marsden NHS Foundation Trust, 2015. The Royal Marsden Manual of Clinical Nursing Procedures, 9th edition. An example of an evidence-based approach: personal cleanliness. Personal cleanliness is a fundamental value in society. Often, when patients become unwell, they depend on nurses to assist them with meeting their personal hygiene needs. When this occurs, it is important that the nurse observes and assesses the patient's needs on an individual basis. Some patients may have a long-term need for personal care support, such as those with dementia or a severe learning disability. Their family and carers will know them best and are best placed to advise you on how best to provide such personal care. Hygiene is a personal issue, and everyone will have their own individual requirements and standards of cleanliness. The nurse should not impose his or her own standards of cleanliness on the patient, or even assume that theirs will match those of the patient. Within the assessment, the patient's religious and cultural beliefs should be taken into account and incorporated into care. When the patient has any degree of cognitive impairment, the approach taken to providing any personal care must consider how the patient is likely to experience that care. For example, a patient who has dementia may not know who you are or what you are doing, and so may need to be oriented and talked through the process to prevent them from becoming distressed. Personal hygiene is individual to that person and is also based on family influences, peer groups, economic and social factors. Berman et al. 2010. In Western culture, privacy is of the utmost importance and considered to be a basic human right. In addition, in some religions, such as Islam, modesty is crucial and can be challenging to manage in the hospital setting. Hollins, 2009. Patients may feel a great deal of embarrassment having to depend on another person to help them with an extremely private act. It is therefore surprising that so little reference is made to this in the literature. However, in the clinical situation, the best person to discuss this with the patient, exploring with them how they want their hygiene needs met, and identifying any specific requests they may have related to their culture or religion. Pegram et al. 2007.